Sarah, the story was absolutely fascinating. Let's start at the high level. Why have anti-vaxxers picked women as a target?
Well, it's really because it worked the last time. Women have been the target of anti-vaxxers going back quite some time because really the conversation before COVID-19 was about mothers and their babies with the MMR, measles, et cetera. And so what the anti-vaxxers had, their strategy at this time was really just to put COVID in front of vaccine and use the same playbook that they'd used previously because it worked just that well. And that's what we're seeing right now, and it's resonating among so many women that Sarah Fryer and I talked to for this piece.
What did the women tell you? Because I understand you got a lot of different reasons from women who weren't getting the vaccine, and of course, the possibility of not being able to have a child was high on that list.
Yeah, so we heard the gambit, really. I think that the most prevalent one was really around safety. So people took an exception to how quickly the vaccine was produced, how they wanted to wait and see, really, and that's vaccine hesitancy, almost as a definition. And so that was a really big chunk. The fertility part was very interesting as well. And a lot of that stemmed from a blog that actually showed up on social media in early December of last year. And that blog claimed wrongly that the vaccine inhibits women's fertility. And that really found itself all over the social platforms. And that was just weeks before the emergency authorization was issued that allowed this vaccine to be given right at first to nurses and first responders. And it was a lot of those nurses that we talked to right at first. We went into nursing Facebook groups. We went online and we saw the conversations that they were having. And nursing as a profession skews very female. And that's really what they were talking about was questions about, well, if I'm trying to become pregnant or if I'm pregnant already, should I just wait? And that's vaccine hesitancy.
And I just want to add that there is no evidence that the vaccine has a negative effect on women or pregnant women or can harm a woman's fertility. In your view, just as an observer, how are Facebook and Instagram responsible? Are they responsible for how this has proliferated on their platforms?
So they are certainly trying at this point. But their algorithms, their business model, what they try to do is they try to reward really engaging posts, and that's what drives what you see on the platform. And we know, just because of how we've studied disinformation over all these years, that lies really do spread faster than the truth. It is more interesting, more titillating a lot of times. We saw this with, when this fertility blog went out, Pfizer did come back with an answer to this question, does it affect fertility? And they gave a very robust scientific answer full of scientific jargon that we reference in the piece. And it's hard for that type of language to really resonate on social media. You have to, we say that the people who are giving the information have to do a little bit better. They have to live in this world where social media memes, that's what spreads. And the scientific community and the companies, they hadn't quite caught on to that yet.